13 years old. I just felt like really weird and like not comfortable in my own skin.
This is your Aunt Liz. This is kind of who you take after. You not only look like her, but you both have large busts.
I tried to ignore it for a long time and just kind of pretend like it wasn't going on, and then I got random comments at school and tried to just ignore those and not really pay attention in hopes that like everybody else would catch up to me. And I was in choir and they made me wear this red dress, and as you can see, this red dress like draws a lot of attention to your chest area. I originally started out with a 34C. That was like probably 5 or 6 years ago. I guess as it got larger over time, it's just really hard because you'll find your size, but it's, you know, grandma style bras. New York in the summer is really, really hot, like humid hot. Like you can't wear anything more than like a dress or a tank top.
As Devin got older, her bust kept growing and she gained a little bit of weight. She worked very hard to lose that weight, hoping that her bust would go down. But unfortunately they didn't. And I did notice that she was very self-conscious about it. Her style of dressing changed. She started wearing things to cover herself. And it was painful for me to watch and painful for her to have. I've just watched her suffer. I've watched her suffer a lot with this. And I've seen her cry.
I first became aware of the fact that my breasts were pretty large when I was about 18. I started looking at pictures of myself and noticing that it really looked like I was showing a lot of cleavage, and that was not my intent. When my friend actually sent me this picture back from New York, I looked at it and I was completely shocked. I was like, wow, that's some cleavage. And then this is when I turned 21. I actually had a guy, an older man, follow me around that night and then after hours telling me that he thought I had nice breasts. That night just really ate my self-confidence, and I went home and cried and just said, I have to do something.
Large breasts can be a great burden to women. They cause pressure in the chest and in the shoulders, which then transmits to their back and their neck. There's a social embarrassment. Breast reduction surgery allows the woman to have a cosmetic improvement as well as a functional improvement.
And you are? Shirley. Hi, Shirley. Nice to meet you.
I found out about Dr. Stevens actually going online. My mom told me that there was a laser breast reduction that they could do.
I noticed that you've checked off that you're having back pain. And in addition to that, I see you're having shoulder pain and neck pain. How long have you been having the back problems?
Basically, for the last 3 years, I've been experiencing back pain.
Has this affected your physical activities at all?
Yes, a great deal, a great deal.
Do you find yourself not working out or not running, that sort of thing?
Yeah, well, I dance, and my dancing, which used to be a good 8 to 12 hours, now goes for about 4 hours, and then my breasts actually start throbbing.
Most women with breasts that are this large aren't able to dance. And she was already showing some of the signs of the weight of the breasts on her shoulders. Her shoulders were rolling forward. She was complaining of back pain and neck pain. She continued to dance in spite of the size of her breasts. She made a very compelling argument for her breast reduction.
Have you thought about what size you'd like to be when we're done with the breast reduction surgery?
Well, I've thought about it, and I think I'd be most comfortable with a C.
Now, of a C, sometimes people say a large C, a medium C, or a small C. Do you have any feelings about that?
I would say a small C. It's probably what I would be most comfortable with.
I would agree with that. I'm going to give you your gown now, and if you would kindly put it on, I'll examine you, and I'll be right back.
Yeah.
Okay, what we're going to do next is measure your breasts, and we're going to measure from your sternal notch to the nipple and to the fold to try to determine just how much lift you need in addition to the reduction, okay? And Maria's here, and she's going to record for me. Okay, Maria, from her notch to the right fold is 21 centimeters. Did you get that, Maria?
Yes, I did.
Thank you. And to the nipple is 28 centimeters. And on the left, measuring again from the sternal notch, is 21 centimeters to the fold and 28 to the nipple. That's it. Why don't you get dressed, and I'll be back in to answer any other questions you have about the procedure.
Devin is an ideal candidate for laser breast reduction. She's young, she's healthy, she's showing the changes of the heavy breasts with the back pain and the neck pain, and it's starting to interfere with her lifestyle.
So what exactly is the laser bra?
The laser bra is an internal brassiere, in other words, a bra that's inside, that I actually tack on the inside of your chest underneath the breast tissue. And what we do is we treat your skin that is otherwise discarded with the laser. In other words, in traditional breast surgery, breast reduction surgery especially, the skin that is no longer needed is discarded, it's thrown away. Rather than do that, I treat the skin with the laser and create a new bra. That bra then is used to support the breast tissue and to actually keep it up and perky, if you will. We've been doing the laser bra now for over 5 years, and we've found that the women who have it are very happy with it. Many of them do not wear bras after surgery once they've healed.
Right.
Did we send you a brochure from our office when you made the appointment?
Yes, you did.
In there you'll find that there's a list of patients who have had the procedure done. And breast reduction patients are the happiest patients in any plastic surgeon's practice. You may want to call any of those women and just talk to them about things that you might have questions about, even after I've answered all your questions.
Okay.
Be sure to call me if you have any further questions.
Okay, well, I was pretty sure I was going to go with it before. I think I'm actually 100% sure now.
Bye-bye.
Bye-bye.
Are you happy with him?
Yes, I'm very happy. He answered most of my questions.
You want this done?
Yes, I think so.
He knows Devin. He's talked with Devin.
During the hour before surgery, I'm measuring and marking and photographing and generally planning how we're going to do the surgery.
They're going to take care of her. I think if they think she needs anything or needs to see you, that's what they'll do. My hands are like ice.
Have a seat right there. Dr. Claire?
Hello.
Hi.
How you doing?
Pretty good. How are you?
Okay.
If I start crying, it's not because you're hurting me. It's because I'm really emotional right now.
Okay, this is pretty anxious, huh? That's that. You're all set.
Devin, ready to come take a walk with us? I think I'll look good. Not necessarily because of the outside, because I'm going to feel really good.
What we're going to do today is do a breast reduction as well as a lift. The laser bra is actually going to run from here to the chest wall, as so. The tissue of the laser bra is actually skin tissue that has been treated with the laser, which would otherwise be discarded in more traditional approaches. In other words, in traditional breast reduction surgery, this skin is thrown away.
I enjoy operating in general, and I especially enjoy the ability to help people feel better about themselves.
Hang around with your head right up this way, so you're nice and close to Dr. Claire.
I think Devin's self-confidence will do nothing but grow after this. This has been a problem for her for over 4 years. She really needs the surgery.
Okay, we're going to be lasering the breast now, creating the laser bra as well as de-epithelializing or taking the skin off a portion of the breast tissue. Go ahead. And we have a suction device here sucking the smoke. No, let's go right to the side. We'll go right to it. Also, we're making little tabs that will be part of the laser bra that will be affixing her breast to her chest wall, keeping her breast upwards and perky, if you will.
I'm nervous, but I feel better. I do, now that she's actually into it. Surgery's being done. I know she's in good hands. Once she's in the recovery room, I'll be able to breathe again.
I'm removing the extra breast tissue now from the side of the breast and from the middle in order to reduce the size of her breast. She wants to be a small C cup, that is. I anticipate removing about 1.5 pounds from the right and about 1 pound from the left. We're using dissolving stitches so the patient does not have to undergo suture removal, eliminating the discomfort of removing the stitches. Okay, doctor, that's about it. Let's wake her up and put on a dressing.
Okay, we're going to help you sit up now, Devin. You open your mouth. There we go. Good. We're all done. Everything went really well.
Okay, everything's done, and she is awake. I just spoke to her. She's doing great. Her surgery went well, and she should be with us for about another hour.
and then we'll discharge her. The pathologist is going to do a biopsy and look at everything. I also took the mole off under her left breast. There was a mole, a dark mole. Removed that and sent that to the pathologist, and everything looked fine. There's not going to be any problem with it. Okay?
Thank you so much.
You're welcome. Okay, your surgery's over. I just talked to your mother, and I talked to your boyfriend, and told them you're doing fine.
She'll spend one night in the aftercare facility, and then the next morning she'll be brought into the office where we'll change the bra. I'll check the breasts, make sure everything looks great.
I think that the freedom that she'll feel after it is just going to make her even happier than she is. Because even with the problem, she still has a spirit that keeps her going and a wonderful man that she's with.
Like, I was matched with the right breast. Like, for some reason, like, I would feel a certain way and then look in the mirror and be like, whoa, what's going on, you know?